aí galera, aqui quem fala é a Ludmilla. E galera, eu trouxe mais um vídeo pra vocês. E o vídeo de hoje, galera, é de um jogo chamado Surge Squad. Esqueci um nome, mas eu vou deixar aí na descrição se vocês quiserem jogar também. Eu tô aqui com minha televisão aberta. Só um minuto, galera, que eu vou fechar ela para não ficar atrapalhando. Pronto, galera. Então, vamos começar. Tá aqui o nomezinho, olha, galera. É porque eu não sei muito bem de inglês. Galera, quando eu clico...
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
Cuidem bem desses unhas. Olha, Dr. Jeff aqui, galera, olha. No negocinho aqui. Dr. Jeff. Vamos aproveitar, vamos pintar logo tudo aqui, né? Só pra... Aqui, olha, vou passar uma pintadinha aqui também. Prontinho.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Great! Now we'll wait a few minutes for the toe to get numb.
4 minutos depois.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. First, carefully slide one blade of the nail anvil under the affected nail.
Agora, a gente vai cortar a unha dele.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to...
Aí eu resolvi trazer pra vocês. Chega da gastura.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not... When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Eu acho.
Finish by applying some antibiotic ointment on a sterile gauze. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Outro joguinho desse, mas já eu volto com vocês, certo? Bem, galera, eu voltei aqui com vocês. E o que eu escolhi foi um do olho. Aqui, ó, apareceu agora a imagem. Foi o do olho. Olha, a gente vai fazer uma cirurgia em um olho. Vamos começar. Se vocês gostarem muito, eu trago mais cirurgia.
Hello, and welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Galera, eu vou ali já
A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis. Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional and she detected cataracts and recommended her to us for surgery. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
Vamos aplicar aqui, acho que é sedativo. Não, sedativo aí, coloca. Tipo um sorinho, acho que é um soro. Na minha língua.
Just prior to surgery, additional drops of anesthetic are applied.
É cega de um olho, galera. Ou não? É, parece.
We'll use a device called the speculum to hold the eye open wide during the procedure. Place the speculum for me, please. We begin the surgery with a small, painless initial side port incision. This is called a limbocorneal incision. It's done by making a small cut in the limbus with a crescent knife. Next, we use the crescent knife to make a corneal tunnel into the interior chamber of the eye. A thick, transparent viscoelastic fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it. This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our...
É muito chato essa mulher falando. Deixa essa pessoa pra tirar.
Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal. This is done with an extremely thin diamond scalpel. A bent needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the cataract. The needle is dragged to cut a line in the sac. With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it.
Galera, esse não é nojento.
Now you will need to inject fluid into the incision to separate the lens from the capsule.
Qual vocês acham mais nojento? Provavelmente vocês vão
This
achar mais
causes the
nojento
lens capsule to float,
o
so that it can be rotated during the next step. We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens. We repeat the phaco from the other direction to create 4 pieces.
Ainda bem que ela tá com sedativo, galera.
The phaco is then used to suction out the pieces of the old
Como
lens.
se fosse vida real.
I'll need you to remove the last remaining soft cataract material out of the eye, leaving behind the clear, empty lens capsule.
Tira toda a sujeira, eu acho.
When you're done, inject more viscoelastic fluid into the lens capsule to keep it from collapsing. The flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube. The IOL is now injected through a tube into the vacant lens capsule.
Galera, foi aqui mesmo.
A probe is used to spin the lens into
Foi aqui
place.
meu gato, que era minha ruinha.
The thick fluid we added to the eye will need to be removed, and any remaining microscopic cataract fragments should be rinsed out as well. The incisions in the eye are generally self-sealing. Very rarely that we need to add a suture to close the incision. In our patient's case, we don't need any sutures. The lens is now in place. Our patient will need someone to drive her home after cataract surgery, and she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each day for a few weeks after the cataract surgery. And she'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses will also need to be worn to protect her eye from sunlight and other bright light as her eye recovers. You did a great job today, surgeon. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
E galera, hoje agora eu vou encerrando o vídeo por aqui. Espero que vocês tenham gostado. Espero que vocês tenham gostado. Deixe seu like, se inscreva. Se inscreva aí. E também coloquem qual vocês acharam mais nojento. 1 pro dedo, pela cirurgia do dedo. E 2 pelo do olho, certo? Espero que vocês tenham gostado, galera. Beijos e fui!